Healthcare costs are one of the most important factors in retirement planning, especially for people considering living in Europe on a fixed monthly income of $2,000. Many retirees assume healthcare in Europe is universally cheap or free, but the reality is more complex and varies significantly by country, system design, and personal health needs. What matters in retirement is not only the price of healthcare, but also access, predictability, quality, and how costs evolve over time. A budget that works for daily living can fail if healthcare expenses are underestimated or poorly planned. In this video, we examine what $2,000 per month actually covers for retirees in Europe when healthcare is included realistically. Healthcare systems in Europe are often divided into public and private components, and retirees usually interact with both in different ways. Public healthcare is generally funded through taxes or contributions, while private healthcare is paid out of pocket or through insurance. Retirees living abroad must understand how residency status affects access to public systems. Some countries allow retirees immediate access, while others require private coverage or waiting periods. Understanding these rules is essential for building a realistic retirement healthcare budget. Housing choices strongly influence healthcare access, especially for retirees with ongoing medical needs. Living in major cities usually provides better access to hospitals, specialists, and diagnostic facilities. However, housing costs in these areas are higher, reducing the amount of budget available for healthcare. In smaller towns, housing is cheaper, but access to specialized medical care may require travel. These trade-offs directly affect how healthcare expenses fit within a $2,000 budget. Utilities also play a role in healthcare planning, especially for retirees managing chronic conditions. Reliable heating, cooling, electricity, and internet are essential for comfort and telemedicine access. Older housing stock can increase utility costs and reduce overall budget flexibility. Inconsistent utilities can add stress and additional expenses for medical equipment or climate control. These indirect costs are rarely included in healthcare comparisons, but matter significantly in retirement. Food costs are closely linked to healthcare outcomes, particularly for retirees managing diet-related conditions. European diets often emphasize fresh ingredients, which can support better long-term health. However, retirees with specific dietary needs may face higher food costs. Imported or specialized foods can be expensive and affect monthly budgets. Food choices influence healthcare spending indirectly by affecting long-term medical needs. Healthcare costs themselves vary widely across Europe, depending on the system structure and country. In countries like Spain, Italy, and Portugal, public healthcare is widely available to legal residents. Out-of-pocket costs for basic services are usually low, but wait times can be longer. Many retirees choose private healthcare to reduce wait times and improve convenience. Private healthcare insurance in these countries often costs between $100 and $200 per month. In Eastern and Central Europe, private healthcare is often the primary option for retirees. Costs are generally lower, but quality and access vary more by region. Specialist care may require travel to larger cities. Language barriers can increase reliance on private clinics with higher fees. These factors must be planned into a $2,000 monthly retirement budget. Prescription medication costs also differ significantly across European countries. Many medications are subsidized through public systems, reducing out-of-pocket expenses. However, access to subsidies depends on residency status and system enrollment. Private prescriptions can be affordable, but costs accumulate over time. Medication budgeting is essential for retirees with chronic conditions. Stability and inflation affect healthcare affordability over long retirement periods. Healthcare costs tend to rise with age, even in countries with strong public systems. Inflation can increase insurance premiums, private care costs, and medication prices. Retirees on fixed incomes must plan for these increases. A budget that works today may feel tight 10 years later without sufficient margin. Lifestyle choices influence healthcare, spending more than many retirees expect. Walkable cities, public transportation, and active daily routines can reduce long-term medical costs. Social connection and reduced stress also play a role in overall health outcomes. Living in isolated areas may reduce rent but increase healthcare-related challenges. Lifestyle alignment is a critical but often overlooked factor in healthcare affordability. When all expenses are combined, healthcare typically represents a manageable but essential part of a $2,000 retirement budget in Europe. Public systems reduce major costs, while private options provide flexibility and speed. Most retirees allocate between $100 and $300 per month for healthcare-related expenses. This range depends on location, health status, and personal preferences. Maintaining a healthcare buffer improves long-term retirement stability. Healthcare affordability in Europe is one of the strongest advantages for retirees on fixed incomes. However, success depends on realistic planning rather than assumptions of universal low-cost care. Understanding system access rules and long-term trends is essential. $2,000 can cover healthcare needs in Europe, but only when planned conservatively. The real value comes from predictability, access, and stability rather than the lowest possible monthly cost.